Mission Indradhanush program. Recently only we said, no, Janani Suraksha Yojana pado, Indradhanush pado, Asha pado, ANM pado. Nahi pade to you have to sit and work with them. You will be left only with that job. So, what is Mission Indradhanush? Health Minister JP Nadda will feel unhappy if you didn't answer this. He launched it. Diphtheria, whooping cough, tetanus, polio, TB, measles, hepatitis by 2020, assuming that government will be there up to there at that point. 2020. Recently only Maharashtra or some state entrance में इंद्रधनुष के बारे में catch up vaccination बोल के एक क्वेश्चन हमने मॉक टेस्ट में किया ना डॉक्टर. I still remember Vande Mataram program, Indradhanush program. You should be careful what is government proposing. Severe asthma में PEFR is 33 to 50%. That's how the asthma is graded into mild, moderate and severe, and step up approach is there. A थोड़ा above the regular वाला 110 वाला नहीं है ये, थोड़ा ऊपर वाला स्टैंडर्ड है, right? But still crackable. If you prepared with that vengeance, I should only get seat with biting the nails. You don't have any nails left over, no girlfriends left over. All of them left you because you are that nomadic tribe sitting in entrance, and except objective of getting MD, you don't want to give you a time at all. Everybody left you in the life. You will still answer this correctly. ऐसे आदमी बहुत कुछ लोग होते. Submandibular salivary, crackable question, but not a very standard wala pataka. So mandibular branch of facial, lingual and hypoglossal. Diabetic normotensive enterococcus fecalis, linezolid he is taking, high anion gap metabolic acidosis is there. What is the difference between type A, type B? Type A means anaerobic lactic acidosis, type B means aerobic lactic acidosis. That is the fundamental difference. But why sepsis comes under what? Type A, anaerobic. But why do you like to call this as a type B? Because you look at his blood pressure, कितना है? Normotensive, है ना? मैं कहीं देखा normotensive है क्या? हाँ, normotensive. So not because of sepsis he is getting it. So that means it is not type A. Obviously it should be type B. But linezolid leads to type B lactic acidosis. Whether you know it or not doesn't matter. You should know whether it is anaerobic or aerobic. Can sepsis be implicated? So there is a sepsis causing organism found, but because BP is normal, इतना एनालिसिस उतना छोटे दिमाग में कहाँ निकलेगा एग्जाम हॉल में, टू मच. सो दैट्स द रीजन ये वी आर लिविंग इट इन 70% वाला thing. This is Biff Talbot's harp striae, everybody know. But congenital glaucoma में visual acuity is not a early feature, it becomes a little late feature. That's the reason we have to do a screening. Still, ये तो ऑप्थेल्मोलॉजी में वेदांतिक लेवल क्वेश्चन है. तो then abdominal compartment syndrome में what is grade 1 grade 2 level of abdominal compartment syndrome pressures, वो भी पढ़ के कोई गए तो एग्जाम को, either paper is out for him before only or he is that strenuous preparing aspirant. And let me tell you, the top 300 rankers belong to the group of they know grade 1 कितना होता, grade 2 कितना होता. Definitely grade 1 होता है 12 to 15, grade 2 is 16 to 20, grade 3 is 21 to 25 is what you have to basically remember. And reduction of the visceral perfusion and increase in intracranial pressure, they are the features of the abdominal compartment syndrome. Answer is very easy if you didn't look at other options. But why will we will definitely be tempted to look at other options. Why not? Definitive surgery is immediately done followed by closure of abdomen is not the definitive surgery for the underlying cause is not done immediately. They don't there is a definite protocol of management of abdominal compartment syndrome. एक बार review करना. What are the indications for doing a laparotomy, etc., etc. Emergency thoracotomy करने के लिए what are the indications? Esophageal perforation, massive hemothorax, penetrating injury with cardiac tamponade. Directly in the exam hall you have to guess it. ये पढ़ के कैरी करके आंसर करने वाला कार्सिनोमा सर्विक्स स्टेजिंग जैसे कुछ नहीं है. Okay, so you don't need preparation for this. You need preparation only for the first 110. What is this procedure? Too much. Lord Jabule. What is the main difference? Small size Lord, moderate size Jabule. Large size you will do excision of sac plus Jabule. So you must know what is the difference between Lord and Jabule. Where will you do eversion and excision of the sac, etc., etc. हम कार्डियोलॉजिस्ट बनने के लिए तैयार हो रहे. ऑलरेडी कार्डियोलॉजी कैथ लैब में इमेजेस दिखाए तो वेयर विल यू रिमेंबर? आपका कैथ जब वेंट्रिकल के अंदर जाएगा यू विल गेट दिस. Then you get that anacrotic notch in the aortic curve. That's how you identify LV curve and aortic curve. Not with preparation. So directly you have to take a decision. Like an interventional cardiologist, stent lagana, nahi lagana. So if this goes wrong, don't worry. You are not getting seat is not decided by these questions. Let me tell you. If your common sense is really good, 70% of these 55 questions you will involuntarily answer it, right? But 110 should not go wrong. Dilatation curettage, if there is a perforation during sounding, one should, what you will do? Run away from the operation theatre and switch off your phone. So examiner don't want that. Monitor pulse and BP. Patient को pneumothorax है, आ गया, आप needle guided, CT guided needle biopsy कर रहे हैं mediastinal lymph nodes को. pneumothorax आ गया. नेक्स्ट वाला APPG के लिए मैं क्वेश्चन बोल रहा हूं आपको. आप क्या करेगा? कुछ भी नहीं है. ऑक्सीजन लगाओ उनको, उनके बाजू में बैठ जाओ, पेपर निकालो, पढ़ो. Automatically it will resolve. You need not panic and run around. Small pneumothorax occur while you are doing the procedures. Neonatal sepsis. How will you identify it? Refusal to suckle, poor cry, lethargy are common features. If you are a pediatric sincere house surgeon, you will commonly ask the mother, दूध पी रहे क्या? सर पूरा हैबिट हो रहे हैं और baby is getting all sweating on the face, sir, unable to drink milk also, sir, and while he is trying to drink the milk there is a nasal flaring, sir. So common features of CHF, how to identify in a pediatric ward, not by reading. Practical question है. Falciparum malaria है. What is the revised drug policy of India 2013? Malaria is a standard high yield topic, no doubt. SPM में मलेरिया में recent guidelines पढ़ के जाना मिनिमम रेस्पॉन्सिबिलिटी है एंट्रेंस के लिए. बट स्टिल दिस इज लिटिल टफ टू क्रैक ओनली. इफ यू आंसर्ड मीन्स ग्रेट स्टूडेंट यू आर रियली. सो आर्टिसिनेट, सल्फाडॉक्सिन, पायरामिथामीन एंड प्राइमाक्विन. व्हाट आर द डोसेजेस? यू मस्ट बी वेरी क्लियर. Don't say is it single dose, I remember it as multiple doses. We are not asking your guidelines, we are asking 2013 guidelines. This is also no coaching preparation is required. You must know whenever you are doing cricothyroidotomy, where will you put the needle? You must have a practical idea about our laryngeal tract, where is Adam's apple, blah blah blah. Then मेल इनफर्टिलिटी को जांच करने के लिए बॉनिश टेस्ट इज डन फॉर व्हाट? इनकॉन्टिनेंस के लिए. हंड्रेड्स ऑफ टाइम्स वी रेड दिस. फॉरगेट अबाउट द रिमेनिंग ट्रिक. somebody was saying Hunter is to know the motility of the sperm in the in vitro test. to know how is the sperm motility in the cervical mucus outside the comfort of the vaginal canal, in vitro. So is it testing the cervical mucus hostility or the weakness of the sperm? How can you say it is due to male infertility? Can I claim examiner? You got my point. They say that your Kujrat-Miller is what? In vitro to know the sperm mucus interaction. Sperm weak है हो सकता है या sperm strong but mucus is hostile. Then also it can't dance with its tail, sperm. So is it female's hostility or the male's weakness? How to say, call Kurjok-Miller, that is the argument of few people. When option is D so clearly available, why to worry about the remaining three? Huh? So don't waste your money in claiming such questions and fighting with examiner. Examiner will not even, he is already ready. He is doubly ready with the guns to prove that he is right. Huh? Then cardiac involvement, pomp में होता है या नहीं होता? Pomp में होता. Another standard question this is, but high level, थोड़ा distinction level है ये. Huh? It's not that simple as that 110. National programs में malaria eradication program didn't come in 2002 sir. Malaria eradication program came 1953. बहुत जमाने में we thought that we are more powerful than mosquitoes, we can eradicate. Later on we discovered that there is a chance that we get eradicated by the mosquitoes in Hyderabad. Right? Domal Guda is what? When Domal Guda is there in Hyderabad, can you eradicate mosquitoes? Impossible. Huh? Then IgA is found in intestinal secretions and is glycine rich and contributes to its efficacy. Secretory piece protects IgA from denaturation. So both the statements are true, but this is not a straight question. Not easy to crack. Neurotoxicity is not viper. Viper is hemotoxic. I mean vasculotoxic actually. Viper, Russell viper is vascular system. It will affect the blood coagulation system, etc., etc. This is a standard question only. That's the reason 70% of these 55 questions topper will answer correctly. Right? This is a crackable question. Early loss of visual acuity is seen in cupuliform is central, coralliform is peripheral. So whenever the central part of the vision get affected, then it is early to involvement, loss of visual acuity will be there because it is the central part which controls the macula, controls the visual acuity. Then doctor, endocervical carcinoma has been shown to you. So in endocervical carcinoma, cervix epithelium is columnar, it can be removed by avulsion, it is a cause of the contact bleeding, intramenstrual contact bleeding. Madura foot, but lot of people got confused. Codman triangle and sundry appearance, everybody thinks it is only osteogenic sarcoma. But you type Madura foot, Codman triangle, sundry appearance in Google. Hundreds of articles will come where they talk about the radiological appearances of Madura foot has got sundry appearance, not only osteogenic sarcoma. Organism is sundry, X-ray also sundry. अरे इसमें sundry नहीं दिखा रहे. You have to go to the sunset and see it tomorrow evening and come back and check whether it is there or not. Then giving medication to cause the patient's death when the patient was competent to consent but did not. What is this basically called? If he gave consent, it become voluntary. But he didn't give consent, involuntary. If you stop the life support system, it is passive. But अगर आप ड्रग देके उसको मार रहे हैं तो active. So involuntary active. सिंपल एग्जाम हॉल में थिंक करके आंसर करना, ये पढ़ने से आने वाला नहीं है. And there are some places in the world where euthanasia is legal. Then doctor, abrasions heal from the periphery. If you know the fact, you know that, otherwise you didn't know that. Simple. Right? So this another, but patterned abrasions are typically by the application of a force at right angle. This is understandable. Teeth bite marks is an example of pressure abrasion. Easy. So by elimination you should answer this. Right? So इसलिए 70% of 55 questions में लगाया इसको. Colposcopic examination में acetobite area is there, then what will you do? Acetobite होने के बाद biopsy करना. Biopsy करने के लिए Schiller's iodine डाल के glycogen level देख के abnormal areas को identify करके वहां से biopsy लेना. Simple protocol of management of colposcopic guided biopsy. What is true about alcohol? There were DSM criteria given, but it is not 7 out of 11. It is how many? 2 out of 11. Defines the alcohol use disorder. Anyway, gamma glutamyl transaminase will increase is a known factor. How many answered this correct? Right? So 70% of that 55 questions which read situational intelligence. Small saphenous vein terminates in popliteal vein. You can feel yourself the at least one venesection you did. Also you can do wrong. There's no nothing that you did venesection, you did this right बोल के कुछ भी नहीं है. किस्मत. If you have that general map of long and short saphenous vein well built in your mind, you will answer correctly. So you didn't answer means kismat. Middle third of the femur में अगर fracture हो गए तो क्या लगाते? Intramedullary nail which is locked and reamed लगाते. Too much question in orthopedics. We prepared for Bennett fracture, patellar comminuted fracture में वायर लगाते और एग्जामिनर सडनली मिडिल शाफ्ट में अगर फ्रैक्चर हो गए तो क्या करते बोल के पूछ रहे. थोड़ा टफ है. Oh, this is occiput is posterior. You should identify how is the pelvis. Pelvis में what is anterior, what is posterior. If you know, you will answer this. But still common sense question. No coaching will help this. 22-year-old lady, depressed, insomnia, reduced appetite, past 3 weeks after the PG entrance results came. So what do you want to do for her? You be depressed but not more than 24 hours. Right? 3 weeks bole to it comes under major depression and that require antidepressant therapy. So what are the indications according to the UK National Institute guidelines of giving antidepressant in which scenarios is a very important question. Right. Then doctor, what is this? This is a airway, not a lollipop. So पहला you should understand what anesthetic equipment. Casualty में काम करे तो airway को recognize नहीं करते क्या? Simple. Airway को क्यों लगाते? To prevent tongue from falling on posterior pharyngeal wall or epiglottis, उसको मना करने के लिए airway लगाते. Simple question. Why not fourth? Insert into the mouth with concavity towards tongue. Inserted into the mouth. And turn करते. देखिए, अरे डॉक्टर, that's what I was also thinking. How to insert you must know, doctor. You should not have confusion. रिवर्स रेश में लगा के घुमाते ना, otherwise patient will bite your finger, your marriage ring, everything will be in the patient's mouth, right? So examiner want to test कितने बार आप अंदर लगाए एयरवे को, practical question, not by coaching. How is he putting, doctor? You see at least now. You put done. हाँ डॉक्टर, ऑमलेट बनाने के लिए which one garita you will use? डोसा बनाने के लिए which garita you will use? You must be good in cooking. So this is Bakwas towel camp. Bakwas towel camp. Clamp. This is Halstead mosquito hemostatic forceps straight. This is Alice tissue forceps. This is Babcock intestinal forceps. कॉमन सेंस डॉक्टर है, कॉमन सेंस भी नहीं है, किस्मत, अगर आप पढ़े तो पढ़े, आंसर करे तो करे, बट सीट इज नॉट डिसाइडेड बाय दीज इमेजेस. 110 में ही ऑलरेडी आप 50 पर 56 बोल रहे तो यू आर आउट. 9 विकेट्स आउट, 10 ओवर्स ओनली ओवर. गॉट माई पॉइंट. तो यू मस्ट रिकॉग्नाइज वेयर इज द dysplastic cell is there, and accordingly recognize that it is a squamous cell carcinoma. Purpura fulminans, where do you get? Acute meningococcemia and Staphylococcus aureus infection, which is typical symmetric tender ecchymotic area of Purpura fulminans. What do you see in the eye? 50-year-old, grey spot, he has fever, weight loss, etc. Without a question on infective endocarditis, will there be any talk? हम DNB क्वेश्चन बैंक डिस्कस किया, APPG का भी डिस्कस किया. Definitely there will be a question on infective endocarditis. Top 20 topics in medicine. So रिमेनिंग स्टेटमेंट्स देख के आप करेक्ट आंसर करना. ऑप्शन ए को देख के रिकॉग्नाइज करना लिटिल डिफिकल्ट है, तो स्टिल आई पुट इट एज ए लिटिल सिचुएशनल कॉमन सेंस वाला आंसर. Thiazolidine diones you don't give in heart failure. If you know the fact, you cracked the question, right? Then chronic mountain sickness में नहीं होता हाइपरवेंटिलेशन, एक्यूट माउंटेन सिकनेस में होता, बिकॉज ऑलरेडी योर बॉडी इज एडजस्टेड. व्हाई विल द रेस्पिरेटरी रेट विल चेंज? इट वॉन्ट चेंज इन क्रॉनिक माउंटेन सिकनेस. दिस ऑल्सो इज सिचुएशनल कॉमन सेंस. दिस अ ब्यूटिफुल क्वेश्चन, सुपर्ब क्वेश्चन. सो एपिस्पेडियास is typically malformation of penis, but it can also develop in females when the urethra develops too far anteriorly. So epispadias is also a condition you see in females. Hypospadias is male condition. So that's the point. Then vesico-uterine reflux, fistula versus vesico-vaginal fistula. What is the main difference? Vesico-vaginal fistula may there is a involuntary continuous dribbling, not in case of vesico-uterine fistula. So many times we discuss this question and topic. Bonis test क्या होता, pre-swab test क्या होता, color कहाँ निकलता, वो सब डिस्कस किए ना मॉक टेस्ट में. You should not do this wrong. But still ये तो सुपर डुपर वाला आध्यात्मिक चिंतना से प्रिपेयर हुए तो आंसर करने वाला क्वेश्चन है. देन डॉक्टर, दिस इज इम्पॉसिबल. दिस इज इजी क्वेश्चन. देयर इज वन मोर क्वेश्चन ऑन द आयोटिक पेल्विक इंजरीज. वो फिगर वाला क्वेश्चन, वो तो इम्पॉसिबल क्वेश्चन है. एसिम्प्टोमैटिक एब्डोमिनल aortic aneurysm beyond a particular size, What is that size? They require surgical intervention. 5. That's a standard question, all of you know. So that is the reason you must know that except 1 is a wrong statement. 2 and 4 you should recognize as the correct options. Huh? 1 is a wrong statement, no? Asymptomatic abdomen need no surgical repair irrespective of size is wrong. Beyond 5 centimeters they require. That way this APPG is a little cranky paper because this much of dissection is beyond human rights. जरा superficially खेलते खेलते हुए आंसर करो बोले तो आंसर कर सकते. Why a lot of people are unhappy with this paper is already 110 में 50% रॉन्ग किया, ऊपर से चिढ़ाते हुए ऐसे क्वेश्चन आ रहे. तो ऑन द टॉप ऑफ इट देयर इज ऑलरेडी ए वुंड के ऊपर नमक के ऊपर another slap lash. That's the reason people are and already you will go with exam with a weak heart. मैंने ये नहीं पढ़ा वो नहीं पढ़ा, अगर वो भी आ गए तो मैं क्या करूं बोल के if you have gone to exam means you are hypotensive shock में चले जाते. Now I understood while discussing these questions. But 110 comfortable or not? वो 110 high yield topics से सुबह सुबह उठ के सरस्वती नमस्तुभ्यम you did a little prayer and went to reading room and read the entire day. ऐसे Ramudu Manchi Baludu kind of students will answer 110 out of 110. All these things are little, it is equally tough for everyone. Mechanism of P53 क्या होता है? Promotion of DNA report, promotion of apoptosis, they are all the things, cyclin dependent kinase, etc. etc. This is also a very tough question, not that easy, doctor. I don't call this as easy to crack. Because common mistake हो सकता है standard nuclei and ground glass hepatocytes, but which is not true. This is the image of acidophilic bodies, apoptotic bodies, but still you can answer it. Why? If apoptosis is in the options, that is definitely the answer examiner is waiting for. I told you, no, in our mock test discussion so many times. Why sir? Hypertrophic scar versus keloid. Examiner expects every exam differences. So which will occur after few months, doctor? Keloid. Develop soon after surgery होता है hypertrophic scar. Hemodynamics of placenta. So you must know few values in the placental circulation, how many ml per minute, etc. So what is this with a Foley catheter? So typically it is paraphimosis. Paraphimosis will develop if the uncircumcised penis become trapped behind the glands, prepuce. So there is a point. Then parasternal heave is there, palpable P2 means pulmonary hypertension is there, elevated JVP is there. So what is your answer? So there is a pulmonary hypertension, right heart failure, which typically occur in mitral stenosis and any other condition that lead to development of right heart failure, right? Urinary cystosoma also. Japonicum involves pulmonary vessels leading to pulmonary hypertension बोल के है ना concept है, उसके ऊपर. इसलिए इसको 55 वाला क्वेश्चन में लगाया, 110 वाला नहीं है. Then if you look at the anti-thymocyte globulin which you use in induction, what is the purpose of doing selective renal angiogram? To identify any renal artery stenosis preoperatively in the donor's, in the recipient. So to recognize that we do the selective angiography, not to know the vascular anatomy for anastomosis के लिए नहीं करते, not to know the anatomy के लिए नहीं करते, मगर टू नो द ऑलरेडी स्टेनोटिक रीनल स्टेनोसिस भी है तो then if you do transplant then that stenosis is going to affect it, so that you need to be clear. इसके लिए Mrs. B aged 32 comes to gynec OPD. HCG levels are typically returned to normal within 8 weeks. Now her follow-up advice would include what? So typical management of a molar pregnancy. How do you follow up? How do you treat? And when do you give prophylactic chemotherapy, etc.? You must know the guidelines. What is there behind the posterior aspect of the body of the pancreas? So you must know the relationships of the pancreas. Once more, little tricky question. एनाटॉमी पढ़ के गए तो 3 मार्क आएगा, नहीं पढ़ के गए तो 4 मार्क आएगा, ऐसा. Then multiparous woman is developing cardiac failure. Typically is what, doctor? Peripartum cardiomyopathy. Epidural anesthesia में catheter लगाते and you keep giving analgesia, but headache is more often a feature of spinal anesthesia. Then regarding soft tissue sarcoma, so death is due to lung metastasis, but what is the commonest histological variety? Rhabdomyosarcoma is the most common soft tissue sarcoma. मोस्ट कॉमन लोकेशन कहां होता है? रेट्रोपेरिटोनियल में नहीं, ग्रॉइन, थाई, नी, ग्लूटियल एरिया, दे आर द मोस्ट कॉमन एरियाज. देन फ्लूइड रेस्ट्रिक्शन एंड नॉट मेडिकेशन इज बेस्ट फॉर द मैनेजमेंट ऑफ एसिम्टोमेटिक हाइपोथर्मिया विद सीरम सोडियम लेस देन 120. सो दैट इज ए ट्रू स्टेटमेंट. व्हाट इज कोनिबैक्टन? It is a non-peptide inhibitor of ADH, conibactin. So if you give conibactin, it increases the risk of variceal bleeding, so contraindicated in cirrhotics with hyponatremia. So it is above the level of normal preparation. However you prepared, still these things are new thing for you and also for topper. Assuming you can also be a topper, but मैं बोल रहा हूँ general case control trial में. Assuming topper is a case, you are a control. Now, village health guide का criteria, we are interested about medical officer में होने के लिए क्या है criteria? तो he should be a permanent resident. Then except 4, what is 4? Should be able to spare 8 hours daily. Too much, doctor. Medical officer only will not spend 8 hours daily. Where will village health guide? You will expect him to, even if you expect, who will go and test him? You need to post an officer, and that fellow should also spend 8 hours of time, no? So that is the whole problem of rural health. Now what is this? Classically, cysticercosis. So these are all the true statements about the neurocysticercosis. Common reason why seizures occur in a young female, till morning she is all right and little slightly febrile and developed seizures, generally tonic-clonic seizures. Neurocysticercosis is most common thing, right, in the clinical practice. Option 3. That is the reason now all these statements are true. X-ray of the legs may show multifocal grain-like calcification because of the cysticerci in the muscle. Classical feature of cysticerci. Now, doctors, barded beetle versus Prader-Willi, दोनों में चब्बी, all the conditions में चब्बी baby है. Obesity is a common thing to all, but slight changes between one another. So what is barded beetle? Obesity, retinitis pigmentosa, polydactyly, hypogonadism, renal failure, ये सब चीजें हैं इसमें, इसलिए ये होता है barded beetle. Polydactyly है retinitis pigmentosa with bony spicule appearance of the fundus, along with obesity with hypogonadism, सब कुछ है. But what is carpenter? In this you have craniofacial malformation, syndactyly and obesity. Alstom syndrome also is similarly there. Colorectal cancer, इसमें annular tubular cauliflower सबको मालूम है. Duke classification is for rectal tumors originally. What was it originally? Who knows? What is ultimately? It arises from adenomatous polyp, that is also true. They are all straight pickups from the Barian love. Originally it was for this, means pick up and put as an option. Originally it is for what? Right? But left hemicolectomy के ऊपर controversy है, splenic flexure के ऊपर. Splenic flexure treatment में some authors suggest to perform extended right hemicolectomy. Right? It is like India-Pakistan border, splenic flexure. Does it belong to right side or left side of the colon? We don't know. Right? So, that's the point.